Ever wondered about the buzz surrounding anti-inflammatory diets? Today, we're diving into the heart of this topic, breaking down the facts and debunking the myths. Imagine a diet that not only tantalizes your taste buds, but also works behind the scenes to combat chronic inflammation, a silent perpetrator linked to various health conditions. This is the essence of an anti-inflammatory diet. An anti-inflammatory diet zeroes in on foods that are warriors against inflammation. The goal? To reduce long-standing chronic inflammation within our bodies, which is implicated in a host of conditions, from heart disease and diabetes to arthritis, and even certain types of cancer. But how does an anti-inflammatory diet make a difference? Let's dissect this. Firstly, it helps in reducing inflammation. It's like a firefighter, extinguishing the flames of chronic inflammation in your body. This can help alleviate symptoms and slow down the progression of conditions like arthritis and inflammatory bowel disease. Secondly, it's a champion for heart health. Packed with fruits, veggies, whole grains, and fatty fish, this diet can help lower the risk of heart disease by reducing inflammation in our blood vessels. Thirdly, it's a friend to those wanting to manage their weight. An anti-inflammatory diet can support weight loss efforts, given that excess body fat can fan the flames of inflammation. Fourthly, it aids in diabetes control. This diet champions whole, unprocessed foods with low glycemic indices, helping to keep blood sugar levels steady, a boon for those with type 2 diabetes. And finally, it may play a role in cancer prevention. The relationship between diet and cancer is complex, but certain anti-inflammatory foods are rich in antioxidants and phytonutrients that may help shield against cancer. So, what does an anti-inflammatory diet look like on your plate? Think colorful fruits and vegetables, fiber-rich whole grains, omega-3 packed fatty fish, nuts and seeds brimming with healthy fats, olive oil rich in monounsaturated fats and antioxidants, and spices like turmeric, ginger, and cinnamon. However, it's not just about what you add, but also what you subtract. Limit or avoid processed foods, refined carbohydrates, and sugary beverages, as these are often promoters of inflammation. In essence, an anti-inflammatory diet is a scientifically supported approach to managing chronic conditions and promoting overall health. By focusing on nutrient-dense whole foods and minimizing inflammation-promoting choices, you can support your well-being. However, remember that any significant dietary change should be discussed with a healthcare professional or registered dietitian, especially if you're managing a specific health condition. And that's a wrap. We've just taken a deep dive into the world of anti-inflammatory diets. Here's to making informed choices for a healthier, happier you.